I'm Michael Sokolowski. I'm 35. It's hard for me to make friends just on the fact because I'm missing teeth, and it's like I have trouble even smiling. My self-esteem, I'm kind of like just stuck, I guess, staying indoors or staying at home, so.
In this situation, we had Michael's sister as an advocate. Her children were afraid of him. Whenever he would come over, they would sort of stand back and wonder, what happened to Uncle Michael? What happened to his teeth?
Michael, I would say, wasn't in a good shape dentally. He lost about a half of his teeth, both on the top and on the bottom. I think it was actually a shame that, his smile kind of preceded him as a person. When he was trying to brush his teeth, it really hurt. He said that his gums were bleeding, and it was so painful that he wouldn't practice regular oral hygiene, and he would only brush his teeth maybe twice a week.
For the working poor adults, there really is there's very little in the way of other options. In Ontario, with children, there are a number of programs that are beneficial, but for the working poor, those that are not on social services, and those that do not have dental insurance, there's often very few choices for them to go.
I think for Michael, the AccessToCare Fund was monumental, because I think without it, it would have been really, really difficult for him to afford the type of treatment that we were finally able to provide.
Michael was very obliging. He really wanted some help, and he said he was working a bit. He would help to pay, whatever he could also.
Anytime that he would come to an appointment, we would joke about it that, I would stop him and I would say, okay, we're gonna do this work, but for the next however long, I'm not gonna be your friend. You don't have to like me, but then once we're done, you're gonna feel better and you're gonna be my friend again. When Michael and I talk during his appointment, he says that he brushes relatively regularly, and I can definitely see it in his gums and his teeth.
I brush and floss every day now. Mind you, there has been a few little slip-ups where I've slacked off a little bit, but you know what, it's a work in progress, so.
He wanted to share his experience with his relatives. He actually brought his tablet and he asked me if he could take certain pictures of certain things.
That's the molds for the dentures. I'm hoping for that I'd be able to sit there and actually be able to smile and no one would sit there and look at me kind of funny.
So the next phase for Michael is prosthetic rehabilitation, and we hope to replace the missing teeth. I will be planning the rehabilitation phase in the near future and applying for AccessToCare again. So I think once Michael finally has all of his replaced teeth back, I think it's going to make a huge difference for him.
Thank you so much, because you know what, this is actually, I guess, a change, being from a low self-esteem to kind of rising it up.
And it feels good to know that we've helped somebody, that the Faculty of Dentistry is here to help the community outside.